Garlic can be just as effective as ibuprofen in reducing fever and inflammation. That's right. Plus, it helps protect your heart, lower cholesterol, and boost your immune system. But can everyone take advantage of these benefits? Unfortunately, no. For some people, garlic can actually be a poison. Curious to find out if you're one of them? Stick around until the end of the video, and don't forget to share in the comments if you use garlic regularly and how you incorporate it into your routine. When it comes to home remedies, teas, or medicinal plants, it's often overlooked that these natural treatments can have contraindications. They can be harmful to certain individuals, toxic when used excessively, and in rare cases, even life-threatening. In today's video, we'll delve into the potential dangers of this seemingly harmless food before you add it to your meals. Is garlic really unsafe for some individuals? What do the researchers say? Wondering if you might be at risk? Keep watching to find out. If you have any of these 8 health conditions, it's best to avoid garlic. Watch until the end because if you fall into the last category, you should stop using garlic immediately. 1. People taking blood thinners. People who are taking blood thinners such as warfarin, aspirin, or clopidogrel should be cautious about consuming large amounts of garlic. Excessive garlic intake can heighten the risk of bleeding, especially when combined with these medications. The reason behind this is that garlic contains compounds like allicin and aegin, which have anticoagulant properties. This means they help thin the blood, similar to what these medications do. When you mix the anticoagulant effect of garlic with the medications, the result can be excessive blood thinning, increasing the risk of bleeding or hemorrhages. While it's rare for garlic to cause bleeding, there is a report about someone who had increased bleeding after consuming about 12 g of garlic, roughly 4 cloves daily, before surgery. In another case, an individual noticed significant bruising and discoloration following surgery. This might have been linked to a dietary supplement they were taking, which included fish oil and 10 milligrams of garlic concentrate, both of which can influence blood clotting. 2. Pregnant women. During pregnancy, garlic demands careful consideration, particularly in its concentrated forms such as supplements, extracts, or raw, high doses. While garlic is known for its numerous health benefits, it can pose potential risks for pregnant women. One significant concern is its ability to stimulate uterine contractions and increase menstrual flow, which may endanger the pregnancy, especially in its early stages. This effect, while beneficial for some health conditions, can be problematic for expectant mothers as it might increase the risk of miscarriage or preterm labor. Another critical factor to keep in mind is garlic's well-documented anticoagulant properties. These properties help thin the blood and improve circulation, which in other contexts might be beneficial, such as for heart health or preventing clots. However, during pregnancy, this effect can heighten the risk of excessive bleeding, particularly during childbirth. Given that the body is already in a delicate state during labor and delivery, any additional risk of bleeding could complicate the process, potentially leading to dangerous outcomes for both the mother and the baby. In addition to its effects on blood clotting, garlic also influences blood pressure. Its sulfur compounds, like allicin, contribute to the relaxation of blood vessels, which can lower blood pressure. While this is typically beneficial for people with high blood pressure, pregnant women who already have low blood pressure or are taking medications to manage it need to be cautious. Excessive garlic intake could further lower their blood pressure, leading to symptoms such as dizziness, fatigue, fainting, or in extreme cases, dangerously low blood pressure levels that could harm both the mother and the developing fetus. Given these potential risks, it is essential for pregnant women to consult with their healthcare provider before significantly increasing their garlic intake, especially in supplement form. Although moderate use of garlic in cooking is generally considered safe, consuming garlic in large amounts or as a concentrated extract could present risks during this sensitive time. Your healthcare provider can help assess your individual health needs and determine whether garlic is safe for you to consume during pregnancy. 3. People with low blood pressure. If you have low blood pressure, garlic can be a controversial ingredient in your kitchen. Despite its numerous health benefits, it has a peculiar characteristic: it can further lower blood pressure. This is due to the presence of sulfur compounds like allicin, which promote the relaxation of blood vessels and facilitate blood flow. For most people, this hypotensive action of garlic is beneficial, helping to control high blood pressure and prevent cardiovascular diseases. However, for those who already have low blood pressure, excessive garlic consumption can worsen the problem, causing symptoms like dizziness, weakness, blurred vision, fainting, and even mental confusion. 4. People with kidney problems. People with kidney stones should be cautious when consuming garlic due to some specific factors. Garlic, despite its many health benefits, contains compounds that may not be ideal for those with this condition. Firstly, garlic is rich in oxalates, which are substances that can contribute to the formation of kidney stones, especially for those prone to calcium oxalate stones. According to a study, raw garlic contains 360 milligrams of oxalate, so excessive consumption of oxalate-rich foods can increase the concentration of oxalate in the urine, which can promote stone formation. Additionally, garlic contains sulfur compounds that can irritate the gastrointestinal tract and affect kidney function, especially in people with already compromised kidneys. Although these compounds have anti-inflammatory and antioxidant properties, they can exacerbate pre-existing kidney problems in high doses. 5. People with diabetes. Another group of individuals who need to be especially cautious when consuming garlic are those with diabetes. While garlic is often celebrated for its numerous health benefits, for people with diabetes, it can be both a friend and a potential risk. On the one hand, garlic contains powerful compounds that can help lower blood sugar levels. This might sound like an advantage, especially for those aiming to keep their blood sugar in check, but the reality is a bit more nuanced. Garlic contains sulfur compounds such as allicin, which not only give it its characteristic smell and flavor, but also contribute to its medicinal properties. Allicin is known to help regulate blood sugar levels by improving insulin sensitivity. Insulin is the hormone responsible for allowing glucose from the bloodstream to enter cells, providing them with energy. When cells become more sensitive to insulin, it becomes easier to control blood sugar levels, preventing spikes that are harmful to people with diabetes. Additionally, garlic contains antioxidants that can help reduce oxidative stress, a condition in which harmful free radicals damage cells and tissues, which is especially prevalent in individuals with diabetes. However, this blood sugar-lowering effect of garlic, while beneficial in some cases, can become problematic for people who are already on medication to control their diabetes. Most medications prescribed for diabetes, such as metformin, sulfonylureas, or insulin itself, work by lowering blood glucose levels. When garlic is added to the mix, it can enhance the effects of these medications, leading to an excessive drop in blood sugar levels, a condition known as hypoglycemia. Hypoglycemia occurs when blood sugar levels fall below the normal range, and it can be dangerous if not addressed promptly. Some of the initial symptoms include dizziness, tremors, cold sweats, irritability, and feelings of mental confusion. If not corrected quickly by consuming something sugary, it can escalate to more severe issues such as fainting, seizures, and in extreme cases, even coma. For individuals managing their diabetes with insulin injections or oral medications, the addition of garlic to their diet can potentially increase the risk of such dangerous episodes. It's important to note that the severity of the interaction between garlic and diabetes medication can vary from person to person. Factors such as the amount of garlic consumed, the specific type of medication being taken, and the individual's overall health status all play a role. For example, raw garlic tends to have a more potent effect on blood sugar levels compared to cooked garlic because allicin is more concentrated when garlic is in its raw form. Likewise, garlic supplements, which often come in the form of capsules or powders, can contain even higher concentrations of allicin and other active compounds, thereby increasing the risk of hypoglycemia. Because of these potential risks, it is highly recommended that individuals with diabetes consult their healthcare provider before making any significant changes to their diet, especially if they're considering adding more garlic. Your doctor can help assess the specific risks and benefits based on your current treatment plan, the type of diabetes you have, and your overall health. For some people, it may be safe to incorporate garlic in moderation, while others may be advised to avoid it altogether, especially if they're on stronger or more aggressive diabetes medications. 6. People with stomach and gastrointestinal issues. Garlic can also be a problem for those with sensitive stomachs or who suffer from gastrointestinal issues. This is due to the sulfur compounds, such as allicin, which give garlic its characteristic flavor and aroma. These compounds, although medicinal, can irritate the lining of the digestive system, especially in those who already have some sensitivity or pre-existing condition. This can lead to unpleasant symptoms like gastrointestinal discomfort, abdominal pain, gas, nausea, vomiting, and diarrhea. For people with gastrointestinal diseases such as irritable bowel syndrome, IBS, or gastroesophageal reflux disease, GERD, garlic can be even more problematic. Allicin can increase stomach acid production, worsening reflux, and can also accelerate intestinal motility, causing diarrhea in those with irritable bowels. 7. People allergic to garlic. Just like any food, garlic can cause allergic reactions in some people. The signs can range from simple itching or redness on the skin to more concerning swelling of the lips and tongue. In more severe cases, the person may have difficulty breathing and, in extreme cases, experience anaphylactic shock, which is a medical emergency. Therefore, if you experience anything unusual after eating garlic, don't wait. Seek medical attention immediately. 8. People with a history of bleeding. If you have a history of bleeding, such as ulcers, hemorrhoids, or other digestive problems, you need to be careful when consuming garlic. And attention, women. This also applies to you, especially if you suffer from heavy bleeding during your menstrual period. As we mentioned earlier, garlic contains compounds that can interfere with blood clotting, making it difficult to form clots that are essential to stop bleeding. The same rule applies to people with conditions that already affect clotting. A 2022 study reported a case where a 74-year-old woman developed anemia, likely due to increased bleeding caused by consuming large amounts of raw garlic. The garlic may have inhibited platelet aggregation, exacerbating the effects of her blood-thinning medications and leading to darker stools and other anemia symptoms. This case highlights the potential risk of raw garlic consumption, especially in individuals taking anticoagulant or antiplatelet drugs. People with hemophilia, for example, a genetic condition that prevents proper blood clotting, should avoid garlic completely. The same goes for those who suffer from thrombocytopenia, a condition characterized by a low platelet count, which are the cells responsible for clotting. Additionally, if you're preparing for surgery or a medical procedure that involves incisions, it's recommended to stop consuming garlic at least 2 weeks before to avoid complications during and after the procedure. Even if you don't have any of these conditions, but notice that minor bleeding, such as cuts or scrapes, takes longer than usual to stop, it's important to talk to your doctor about garlic consumption. As we've seen, garlic isn't for everyone. If you fall into any of the groups we mentioned, like people with bleeding disorders, diabetes, or allergies, it's really important to talk to your doctor before adding garlic to your diet. They can help you understand the risks and benefits, guide you on the best way to consume it, or even recommend avoiding garlic altogether, depending on your situation. But if you don't have any of these conditions, you can enjoy all the benefits that garlic has to offer. It's packed with antioxidants and flavonoids, plus it has antiseptic, antimicrobial, antifungal, and anti-inflammatory properties. Eating garlic, especially raw, is great for your heart, brain, and blood vessels. It helps keep your arteries clean, your circulation flowing smoothly, and even strengthens your lymphatic system. If you want to learn more about the benefits of garlic, check out our video, What Happens If You Eat 2 Cloves of Garlic a Day? We explain everything about the scientifically proven benefits in detail. And here's another tip. The best time to consume garlic is on an empty stomach. At that time, it acts as a powerful detoxifier, eliminating toxins and even helping you expel parasites. But that doesn't mean you can't eat it at any time of day. Garlic, with its bold flavor and unmistakable aroma, offers incredible versatility in the kitchen. For those looking to maximize its health benefits, raw garlic, chopped, minced, or crushed is the best option. You can add it to salads, salad dressings like vinaigrettes, guacamole, or even dips like hummus for a spicy and flavorful kick. If the intense flavor of raw garlic isn't your thing, don't worry. Cooking garlic in soups, stews, stir-fries, risottos, or roasted vegetables helps to mellow its flavor and aroma, making it more palatable. Another delicious option is to roast whole garlic wrapped in foil until it becomes soft and sweet. Roasted garlic can be spread on toast, added to pasta sauces, or even mixed with olive oil for a special touch. For those seeking convenience in the kitchen, garlic powder or paste is an excellent alternative. It can be easily incorporated into seasoning, marinades, and sauces, adding flavor without the need to peel and chop fresh cloves. Garlic oil, with its milder flavor, is ideal for sautéing vegetables, meats, or seafood, and it's also a great option for finishing dishes with an aromatic touch. No matter how you choose to use it, garlic will surely elevate the flavor and health benefits of your recipes. If this video helped you out, why not give it a quick like and share it around? It could really help someone else looking after their health. Do you or someone you know have any of these health issues? Drop a comment and let's chat about it. If you want to stay in the loop with more health tips, just hit that subscribe button and turn on notifications. We release new videos every week. Your likes and comments really keep us going. They show us what you want to see more of. And before you go, check out these 2 videos we selected specially for you. I think you'll love them. Have an awesome day, my friends, and remember to take care of your health. Thank you for watching. See you in the next video.
Bye.